Welcome to the Learn Psychology series. Today, we'll dive into the therapeutic approaches used in healing psychological distress. It's important to understand that these approaches are essential in helping individuals manage their mental health and improve their quality of life. Let's start by understanding the importance of therapeutic approaches. The goal is to help patients professionally, and all approaches focus on aiding the patient in overcoming their debilitating condition. The effectiveness of any therapeutic approach depends on factors like the severity of the disorder, the degree of distress it causes others, and the availability of time, effort, and money. Therapy is a voluntary relationship. Psychotherapy is a voluntary interaction between the client, who seeks treatment, and the therapist, who provides the treatment. This relationship is essential in building trust so that the client can openly discuss their problems. The purpose of the relationship is to address psychological issues faced by the client. Aims of psychotherapy. Psychotherapies primarily aim to change maladaptive behaviors, reduce personal distress, and help clients adapt better to their environment. It's also crucial for clients to improve marital, occupational, and social adjustments. All psychotherapeutic approaches share several characteristics. They involve the systematic application of therapy principles, and only trained professionals can practice psychotherapy. This is because an untrained individual might unintentionally cause harm rather than good. A therapeutic situation always involves a therapist and a client, and their interaction forms the foundation of the therapeutic relationship, which is central to any psychological therapy. Therapeutic goals. The goals of therapy include reinforcing the client's resolve for betterment, reducing emotional pressure, unlocking potential for positive growth, modifying habits, and changing thinking patterns. Additionally, therapy aims to increase self-awareness, improve interpersonal relations, enhance communication, facilitate decision-making, and help clients become more aware of their choices in life. The therapeutic relationship is a special bond between the client and the therapist, known as the therapeutic alliance. It's not just a passing acquaintance but also not a permanent one. The alliance has two main components: a contractual relationship between two willing individuals, the client and the therapist, and the limited duration of therapy, which lasts until the client is able to manage their problems independently. Trust is a crucial element of this relationship. The client must feel comfortable confiding in the therapist, and the therapist fosters this trust by being accepting, empathic, genuine, and warm. This leads to the concept of unconditional positive regard, where the therapist shows non-judgmental acceptance of the client, even if the client reveals unpleasant truths or behaves rudely. Now, let's briefly distinguish between empathy, sympathy, and intellectual understanding. Sympathy involves pity and compassion for someone suffering without fully understanding their emotions. Intellectual understanding is a colder approach that lacks empathy or sympathy. On the other hand, empathy allows a person to deeply understand and feel the other's experience. Empathy is crucial in a therapeutic setting as it helps build a healing relationship. Another vital part of therapy is confidentiality. The therapist must maintain strict confidentiality regarding the client's experiences, thoughts, and emotions. This ensures that trust is never broken, as the relationship must remain professional at all times. The formulation of a client's problem is the next step in therapy. Clinical formulation refers to understanding the client's issue within the framework of the therapy model being used. This involves 1. Understanding the problem fully. 2. Identifying specific areas to target in therapy. 3. Choosing the techniques best suited for treatment. Formulation is an ongoing process, requiring adjustments as therapy progresses. The first sessions are typically where the initial clinical formulation happens, and it's not recommended to begin therapy without it. Now, let's talk about relaxation procedures. Anxiety is often a key manifestation of psychological distress. Reducing anxiety is essential as it contributes to behaviors like excessive eating or smoking. Techniques like progressive muscular relaxation help decrease anxiety. Here, the client learns to tense and then relax individual muscle groups, eventually mastering the art of full body relaxation. And that concludes part 1 of our exploration into therapeutic approaches. I hope this video helped you understand the importance of these approaches in addressing psychological distress. Stay tuned for part 2, where we'll explore more techniques in detail. See you in the next one.